We are here in Tampa, Florida at Syndaver Labs, an advanced biotechnology company that creates synthetic humans and animals for medical testing and training. Joining us is Dr. David Danielson, Vice President of Veterinary Technology, and he's here to tell us about their newly unveiled synthetic horse and feline models. Thank you for having us, Dr. Danielson.
Oh, my pleasure. I'm glad you could come.
Their facility is a favorite of ours to visit, as they're consistently on the cutting edge of medical technology. We've come to witness their unveiling of such revolutionary devices as the full-size synthetic human cadaver, infant-sized models, full-sized canine models, and even wearable anatomical suits for military and real-world training situations.
Syndaver recently unveiled their new equestrian and full-size feline models.
We're always striving to create new things, and we have such a vast market in the veterinary side.
Syndaver is constantly striving to create new technology, as there is always a need in the veterinary field with so many diverse species of animals that require treatment.
That there's lots of opportunities and lots of things that we can make, and people are constantly contacting us with new ideas and new needs that we can meet.
Dr. Christopher Sacules created the Syn tissue, which mimics the fidelity and composure of a human. The University of Florida approached Syndaver a few years ago to create an alternative for live animal surgery.
About 3.5 years ago, we were approached by one of the universities to come up with an alternative for live animal surgery.
Dr. Sacules asked Dr. Danielson to join Syndaver as part of the project to utilize his expertise in veterinary medicine to ensure animal realism.
Way that we can adjust the technology to create fidelity on of course, the dog, and then the cat, and then the horse. Just a testament to how versatile this technology is.
The beauty of the technology is that it's composed of salt, fiber, and water, rather than plastics or silicone, which mimics living tissue and allows for cutting and operation as if it were the real thing.
By altering it in different ways, you can create different textures, and it takes a lot of trial and error. But you can recreate the exact textural consideration as the real thing. So we're able to create capillary beds and vessels within the model so it'll bleed. And that gives such a state of realism that you really can, as a student, perform the surgeries that you would perform on a patient at a hospital.
When you're around these synthetic cadavers, you immediately feel like empathy for them. And I know you laugh, but it's true. As soon as you get around, I do.
So that is absolutely deliberate.
A realistic model is very important in creating a sense of empathy in students, who then begin to care for the model as though it were a living animal.
I remember the first dog, it kind of looked mean. It had a snarl to it, right. And I didn't like that at all. I said it needs to be, kind of happy, have kind of a kindness to it. And so, of course, we have wonderful artists here, and they were able to create that in a manner that I get that all the time. People, they almost fall in love with them.
Each model is unique, handcrafted with specific technologies and capabilities built in. Thus, no two are exactly alike. Therefore, each model is named, shipped, and tracked.
Every model has a purpose and its function, with most being centered around live surgical applications. The new feline model, however, is designed as an alternative to dissection. The idea is to use the feline model in high schools and college courses in place of dissecting a real cat.
Veterinary training often involves terminal surgery of animals or euthanasia, since dissection of a cadaver does not provide the same fidelity, texture, and color of a living animal. Syndaver is striving to change all of that.
Our goal was to be able to create a platform where students can learn anatomy without feeling the moral consideration of having an animal sacrificed.
Newer generations are holding society to a higher level of accountability. This demand is driving a change from live animals to synthetic ones, which requires the models to have a heightened sense of realism to be effective training tools.
The cost of acquiring, housing, and disposing of cadavers is negated with the Syndaver models, saving money for schools. Also, it's becoming increasingly difficult to acquire cadavers for the purpose of training.
It really does not translate. The dissection of a cadaver, the tissue is just horrible. And when I finally got the opportunity to do live surgery on animals, it's like, well, what is this? It doesn't look at all like the real thing. So I really don't know that it is a good platform anyway. And so now in reflection, I wish I had this to learn on.
Each Syndaver model takes years to develop from concept to fruition. The equestrian model, for example, took 2 years to produce.
The equestrian model shown to us is a surgical version with an anatomical reference on one side and an enucleation model on the other. Horses often suffer damage to an eye, which needs to be surgically removed.
Horses often will get damage to their eyes, and one of the procedures that has to take place is actually removing the eye. So this approach is done in the field typically, can be done at the hospital, but many veterinarians, again, have to perform this. And so this model allows each student to have the opportunity to actually do the procedure.
In the past, the only training experience a student might have with this common procedure would be left to chance, and whether they happen to be on a rotation at the time of surgery.
But there's muscles back here that you have to cut to get access to it.
However, with the Syndaver equestrian model, each student can perform a practical surgery as often as needed until they get it right.
I think I'll reach back and cut and continue to work around it. There it is. Perfect. The goal is to create, competent, but also you want to remove or distill some of the fear in these students. So they've already done it, they've already seen it. I want it to be harder than the real thing. It'll die, and it can be hard sometimes to get it to stop bleeding, and it's a challenge, and I want that challenge to take place on the model instead of in the real world and on a patient's or client's animal.
The equestrian model is also designed for practicing endoscopic procedures, where students can insert scopes into the nose and run tubes down the throat into the stomach of the model. Horses also have guttural pouches at the back of the throat, similar to sinuses, which the realistic model has as well.
They often get infected or occluded, and basically that procedure, we're passing that tube. The external is kind of cool, but the internal architecture of the sinus and all that is also absolutely real.
Syndaver tissues last indefinitely if cared for properly. The key is to store the tissues in water preservatives.
The bulk of the model is silicone, but the areas of interface where the students are cutting or interacting manually are syn tissue. Most training models available on the market from other companies are solely silicone-based and are not nearly as adequate for realistic learning.
This is what sets us apart from what's out there now. Everything's silicone because that's what's available, but texturally it's not adequate. It doesn't behave correctly, and this does. So it really sets us apart, I think.
Ultimately, Dr. Danielson would like to see the models available for the public to purchase to learn about anatomy and dissection anywhere, including at home.
It's so unlike what was before because the formalin, the toxins, the degradation of the smell was so vile that you could never do this, in your living room. At this point, we're looking to engage this really in high schools and middle schools too, where we can maybe even get this introduced at a younger level. So again, that would try to instill in those individuals to go forward to kind of think about the biological science.
This will be like the new chemistry set. I remember getting a chemistry set and it got me interested in science when I was 10, 11 years old.
Me too. That's an excellent analogy.
The feline model has the same external musculature, vascular systems, and nervous systems as a real cat. Students can open the chest to reveal the organs. They can also expose the abdominal cavity with a peritoneal sac to reveal and manipulate the organs and the tissues contained within.
Syndaver's goal of providing uniquely realistic models for veterinary students around the world continues to grow with the release of the feline and equine versions. Dedicated to saving the lives of countless creatures while also providing cutting-edge training for future vets continues to be their mission.
Anything we can do to get this technology out into the world, and it just makes me very happy that there's an interest in this whole new world, I guess, of animals.
And I'm sure we'll be back out here again in the next 5-6 months because
we have there's some more things in the works, so that's absolutely a given. There's going to be some.
No doubt, and we'll be there to cover that too.
Awesome. I look forward to it.
Thank you for watching American Medicine Today, and make sure you stay tuned because coming up next, a story of recovery.